Thank you. Lyme disease becoming more common each year with warmer temperatures, longer summers, and humidity changes. It's important to know the warning signs and symptoms of Lyme and to stay protected while you're outdoors, too. And joining us today is Chief of Infectious Diseases at the Hospital of Central Connecticut and Mid-State Medical Center, Dr. Virginia Bieluk. Doctor, thank you for being with us today.
Oh, you're welcome. Pleasure to be here.
All right, let's talk about the early signs and symptoms of Lyme disease, because sometimes this can be mistaken for something else, right?
Well, usually Lyme disease presents with the characteristic bullseye rash. Other symptoms that can occur include fever, muscle and joint aches, and headache.
Okay, so if you see these things and you're really concerned, first off, I'm assuming you should get to your doctor. And what kind of treatment is available?
Absolutely. If you think you have Lyme disease, you should see your healthcare provider. We have antibiotics which can treat Lyme disease and prevent future complications from Lyme disease.
So, you know, I know the battles against Lyme differ in length here. Some people can battle this for a long time, right?
Well, Lyme disease is treatable, and we do know, however, that some people who have Lyme disease will have prolonged symptoms. There's no reason to take further courses of antibiotics, and eventually you should feel better from your Lyme disease. There are also other late complications, such as heart involvement or what we call meningitis, which is inflammation in the brain, but these two are curable with antibiotics.
What's the time frame normally? And I know there's no one-size-fits-all here, but between diagnosis and, boy, we've shaken this, how long does it take?
Well, that's going to vary for different individuals. Some people will get treated for Lyme disease and get better right away, and other people will not feel well for a number of months. But again, everybody's different.
Okay, why do you think we're starting to see an increase in these tick-borne illnesses here in Connecticut?
Well, we think that climate change is contributing to expansion of the tick habitat. Ticks are better able to survive through the winter during a warmer winter, and then the weather turns warm and people go outdoors and they get exposed to ticks, and ticks carry both Lyme disease as well as other tick-borne illnesses.
Okay, so I guess the simple thing is not to get this in the first place, right? And there are some things you can do that make it less likely that you will get this. What should people do?
Exactly. Prevention is paramount of importance. When you go outside, you should try to wear long sleeves and long pants and tuck your pants into your socks. Avoid tall grass. If you're walking on a trail, walk in the middle of the trail. Use tick repellent before you go outside. And when you come back in, inspect for ticks, because the shorter the tick is attached, the less likely you are to get sick from a tick-borne illness.
And that's a good look, too, with the pants tucked in the socks, right? We like that?
Well, it keeps you safe.
It sure does. Dr. Virginia Bieluk, thanks for your time today. We appreciate it.
You're welcome. Bye now.
Thanks, Doctor. All right, 2+ years.